This is Courtney Horsman. I'm going to be presenting material regarding the Radiology 2.0 One Night in the ED application. In 2005, Dr. Kornfeld developed a website captioned One Night in the ED. This website was devoted to providing education for everyday emergency medicine imaging pathology. This website provided inspiration for what is now known as the Radiology 2.0 One Night in the ED app. This app was released in 2010, marking the first radiology teaching file to simulate reading scans at a PACS workstation. This app presents teaching files in a way not previously seen. The 2.0 app denotes the next generation in interactive radiology education. This application is an outstanding teaching tool for medical students, residents, and even medical doctors who want to improve their ability to read CAT scans on emergency cases. The Radiology 2.0 app is intended to be used as an instructional tool that presents a series of cases, enabling users to simulate reading CT scans at a PACS workstation. This app includes labeled images after each case that highlights pathologies and relevant findings. One Night in the ED contains cases commonly found in the emergency department setting. This includes acute abdominal, pelvic, and thoracic pathologies. This application represents an easy-to-use, free teaching tool for trainees or medical students regardless of specialty. It consists of 65 cases based on body CT imaging. Topics covered include common disease processes found in any emergency room, which includes, but is not limited to, bowel obstruction, diverticulitis, renal obstruction, appendicitis, pancreatitis, pyelonephritis, cholecystitis, ischemic bowel, and trauma. This app is engaging, educational, and user-friendly as it provides high-quality axial images, easy navigation, hyperlinks to key findings, relevant topics for radiology residents, and an efficient flow of CT images for application users. The home screen and main menu provide options to switch answers on or off. Here we are looking at the abdominal pain and distension of case study number 1. A brief description of patient presentation is shown here. After viewing the CT image, you click on Discussion. This includes information for small bowel obstruction. The image has highlighted areas with colorful schematics in blue, pointing out areas of concern in conjunction with explaining and interpreting the image. The legal and ethical guidelines and ramifications surrounding this application are minimal, being that the information provided is anonymous. There are no opportunities for insertion of patient information, making Radiology 2.0 A Night in the ED compliant with current HIPAA regulations. The overall analysis of this application is quite positive. This app is an excellent resource providing scrollable CT images in a simulated series for recurrent diagnosis in the emergency department setting. This app is free for both Android and iPhone users. A thorough review of cases with take-home points is provided. This app also features sections on blunt abdominal and chest trauma, giving users a wide variety of what one might see during a night in the emergency department. The scroll-through with touchscreen mimics an actual CT as if the user was sitting at a PACS workstation. The downside or cons to this application are minimal plain films in comparison to CT images. There are no neuroradiology or musculoskeletal images available on this application. This app reads like a print book due to the images not being attached. And finally, the application uses 237 megabytes, of which takes up quite a bit of storage. In conclusion, I would recommend this application to any medical student or resident enrolled in a radiology training program. It's important to practice simulations in a real-world environment of reading CAT scans in the emergency department setting, giving you insight into One Night in the ED.